In Appalachian communities, opioid overdose deaths have been at a higher rate than in urban communities. Yet the people in those communities face much greater barriers to accessing treatment. The Rhodes model is a way of making that treatment more accessible and addressing that disparity. Methadone maintenance treatment can reduce overdose rates by 50% or more. It can also reduce infection rates, crime rates, illicit drug use, improve retention and treatment, and in some instances also improve employment rates in some communities. To a person with opioid use disorder, medication-assisted treatment like methadone maintenance can make all the difference. Say you're a person with an opioid use disorder and require methadone maintenance treatment. The nearest clinic could be hours away. And methadone maintenance treatment, the medication regimen requires sometimes 6 or 7 days a week dispensing. When someone first starts treatment, that is the frequency. And if a clinic is 2 hours away, someone could be spending 4 hours of their day just to get back and forth to and from treatment. How can you maintain your obligations to work and your family with that kind of time commitment? Without the Rhodes program, providers face a lot of barriers in trying to open a new OTP. It's a highly regulated treatment modality that has very specific regulatory requirements, staffing requirements, and financial burdens for providers trying to open a new program. The Rhodes program features a partnership between an opioid treatment program, or OTP, which may be in an urban location, and rural organizations outside of metropolitan areas. The OTP serves as a central location offering a range of services, including methadone prescribing, methadone dispensing, telehealth, counseling, provider-to-provider consultation, and financial and operational support. Auxiliary medication sites in rural areas, meanwhile, focus on methadone dispensing, telehealth visits, family and individual counseling. The benefits to patients of a program like the Rhodes model is that it not only saves time by making it more accessible right in the rural communities, which allows people to fulfill their obligations to their families and continue to work, but it also makes treatment from the central OTP accessible to them through telehealth, which has been proven to work and in some instances as effective as in-person treatment. So they can access an array of treatments like individual sessions, group therapy, family services. In addition, the Rhodes model provides a level of privacy for them to access the treatment where stigma can be strong in those communities. Methadone maintenance treatment works. It is medication that has been proven for over decades to be the most effective in treating opioid use disorder. It is not substituting one drug for the other. The Rhodes model is beneficial for providers and organizations in rural communities because it reduces the regulatory burden of trying to establish a new clinic. The central OTP manages and operates the clinical functions of the program. It also makes the comprehensive services from the central OTP accessible to the patients they serve in the rural communities. There is also the opportunity for collaboration between the rural providers and the central OTP specialists when needed.